Welcome to our first lecture on cardiopulmonary rehabilitation. In this lecture, we will discover the need to thoroughly assess our patients for their ability and readiness to participate in a cardiopulmonary rehab program. It is only after this evaluation that we can truly determine our patient's needs and match our treatment plan accordingly. The process of determining the most appropriate interventions to address and achieve these desired outcomes is called patient-client management. And the elements in this process are, number 1, examination of the patient, which includes history, review of systems and tests to measure and collect data on the patient. 2, evaluation of the data to make a clinical decision. 3, diagnosis, which uses the information gathered to determine the ability of the patient to guide the therapist toward the proper interventions and is usually given within a protocol. It is not to be confused with a medical diagnosis, which may only be made by the physician. 3, prognosis, which is used to predict the patient's level of optimal function and the length of time to achieve it, and a plan of care. 4, intervention. And 5, outcomes. The patient-client history should begin with a review of current symptoms and medical issues, past medical history, which can be obtained from the medical chart and patient-family interviews, and other members of the healthcare team treating the patient. The patient-client history should include the following information. 1, general demographics such as age, gender, race, ethnicity, primary language, and education. 2, employment work history, including current or prior work jobs, school or play, community and leisure activities. 3, living environment, including any equipment used at home, living environment, or any anticipated changes in environment. 4, general health status, including both physical and mental health, social support, psychological functions such as memory, reasoning, depression, and anxiety. 5, social health habits, including smoking, drug abuse, and level of fitness. 6, family history as related to the patient. 7, medical surgical history, including diagnoses, surgeries, or other interventions. 8, current conditions, chief complaints, and if there have been previous interventions. 9, functional level, including self-care and activities of daily living, such as brushing teeth or walking around the home. 10, medications to treat current condition and all medications for any other conditions. 11, clinical tests such as lab and diagnostic tests, review of records and other clinical findings such as nutritional status. A review of systems must also be done. When looking at the patient's medical chart, the diagnosis and date of primary and secondary diagnoses should be noted as the date of an event determines whether it's acute or chronic. When assessing symptoms for cardiopulmonary rehab, a focus on both cardiovascular and pulmonary symptoms are very important, such as chest pain, tightness, pressure, shortness of breath, palpitations, indigestion, or burning. Classic pulmonary symptoms may include shortness of breath, dyspnea, wheezing, coughing, increased work of breathing, and sputum production. Changes of any of these symptoms on exertion should be noted. Other medical problems will also determine whether a treatment plan is feasible for a patient, and medications give insight to a patient's past and present medical history. And lastly, risk factors for heart disease should be evaluated as they may be incorporated into the treatment plan. Risk factors include hypertension, smoking, high cholesterol, family history, stress, sedentary lifestyle, advanced age, obesity, and diabetes. Other questions of importance are social history that can affect the cardiopulmonary system, such as illicit drug use, smoking, and excessive alcohol consumption, and lab data might give insight to clinical status. Lab data may include cardiac enzymes, lipid levels, CBCs, BUN and creatinine, ABGs, cultures and sensitivities, coagulation studies, electrolytes, and glucose tolerance. Further important information to review are the chest X-ray and other imaging results such as CT or MRI, and respiratory interventions including use of oxygen, how much and how delivered, and correlating ABGs, CPAP use, respiratory treatments, and any other respiratory devices. Results of ECG and PFTs should also be noted as they can determine level of functioning. PFT results are primarily used to identify a baseline of pulmonary dysfunction and to follow the progression of respiratory dysfunction. ABGs provide current acid base and oxygenation status, and cardiac catheterization data may provide assessments of cardiac muscle and anatomy, and vital signs such as heart rate, temperature, blood pressure, and respiratory rate can help assess whether current interventions are improving the patient's status. The course of hospital stay may reveal clinical course, and nutritional intake is especially important for underweight or overweight patients, particularly those with cardiopulmonary diseases. Occupational history may help set realistic goals, assisting the patient on returning to work in a timely fashion. Lastly, the home environment and family situation may provide insight as to the patient's ability to respond to rehabilitation. The next step in evaluating a patient is to talk directly with the patient and their family. Not only does this establish rapport and communication, but can determine readiness and understanding of the goals of rehabilitation. The last area in evaluating a patient we will briefly discuss is the system review and physical exam. The system review incorporates information from the medical chart and therapist assessment. It includes the communication style and ability, cardiopulmonary systems review, skeletal review, neuromuscular review such as balance and gait, and skin for color and integrity. As therapists, we will perform IPPA with inspection giving us key information as to level of consciousness, facial characteristics such as grimacing, etc., effort to breathe including patient compensatory positioning such as tripoding, chest rise and accessory muscle use, pursed lip breathing, increased AP diameter, and skin color for cyanosis, etc. Respiratory rate is important as tachypnea, particularly with accessory muscle use, indicates increased work of breathing and decomposition requiring careful rehab design. This chart shows the expected respiratory rates from birth to adult. Breathing patterns must also be noted. Inspection is completed by evaluation of cough, sputum production, observation of extremities, particularly the fingers for digital clubbing.